Okay. Hi, I'm Dr. Tim Jochen. Today we're going to demonstrate using silicone as an injectable to lift up acne scars. And the nice thing about silicone is that it's permanent. And you want to go to somebody who has some experience with silicone. And the main reason is, first of all, you want to make sure that you're getting medical grade silicone. Because there was a silicone that was FDA approved about 7 to 10 years ago, and it is approved for ophthalmic uses, which means the FDA feels it's safe to use in the body. Some people will try to use industrial strength silicone, and so you want to make sure it's medical grade. That's number one. Number two, we like to use the dropule technique, and what that means is we're putting in tiny little drops of silicone. We're not putting in large quantities of silicone, because what can happen is it can migrate a little bit, and also the body will put a little ball of scar tissue around it, so it may loculate it or create these little pockets underneath the skin that look unnatural. So I love silicone for a couple situations. I like it for lipodystrophy. That means people who have HIV who have lost their fat, number one. Number two, I like it for post-surgical treatment, specifically on the nose, where there's a little dent from a Mohs procedure where we've taken off a skin cancer, because it's a permanent correction and it looks natural. The other situation I like to use it for is in acne scars. And the reason for that is because it does have the longevity, and so it will last forever. So Jessica has beautiful skin, but she just has a couple acne scars. Now, it's not good for just every type of acne scar. It's really best for a rolling type acne scar. And she's got two rolling type. You can tell if it's a rolling type on your own skin by stretching the skin. If when you stretch it, the scar stretches out, then we have a rolling type. Now, there are two other types of scars. We have ice pick scars. Those are the ones where they're deep. It's like you could put a pencil tip or a pen tip into them, and when you try to stretch them out, they're not distensible, so they don't stretch out. The other type is a boxcar type scar, and this looks like it has straight walls down and a flat base. And with these, again, these are very fibrotic or very scarred down types of scars, and so this isn't going to work for those. So we have other treatments for those. So it's very simple. You can see silicone comes as a clear gel, and so what we do is we just go underneath these scars and we just do a small drop of silicone. Just tiny little drop. And then she has one other scar here we're going to do right here, and again, just a very tiny drop like that. And so that's really all there is to it. You know, her other scars we're treating with other treatments, such as derma rollers. That's just a pinwheel. We've done the sublative, which is one of my favorite device treatments for acne. That's a radio frequency type device. And if you check our website, you'll be able to look at these different devices that we have for acne scarring.